now. Yep. Welcome everyone, and thank you for joining this webinar. Today we're gonna talk about emotions and why they are important in general for leading a rich life, and also why they're specifically important for managing hair pulling. My name is Dr. Sofia Wenzler. I'm a licensed clinical psychologist and also the clinical lead at TrichStop, the online therapy program that is basically bringing this webinar to you. And I want to encourage all of you to stay until the end of the presentation. The presentation is going to be about 40 minutes long, and then we have a 20-minute Q&A section at the end. I will only answer questions that are going to be in the Q&A section on Zoom, and you can write them down during the presentation and also afterwards, and I'm going to try to get to as many of them as I can. All right, so let's jump right into it. What are we going to cover today? We are going to talk about what emotions are. I mean, all of us know what emotions are, but like we're going to look at it from a scientific angle, and we're going to specifically think about why we have them. Pesky feelings. And we're going to also talk about what an emotional experience actually is and encompasses. Then we're specifically going to look at the role of emotions for hair pulling and the hair pulling cycle, why keeping track of your emotions can be very helpful and is key if you want to manage your hair pulling. And also we're gonna try out a practical emotion regulation strategy together here in this webinar. Then we're gonna conclude and, as I said, go on to the Q&A section. All right. So just to open your minds a little bit to the topic, I want you to do a really, really quick exercise with me. And what I want you to do is think about for yourself how many emotions you can come up with on the spot and count them. I'm going to give you half a minute for that, starting now. How many distinct emotions can you think of? Okay, that was half a minute. I cannot really ask each and every one of you how many emotions they could come up with, but I do ask this question quite a lot in my private practice. So I know that usually people come up with 5 to maybe tops 10 different emotions. And I also know that usually when asked this question, people are surprised because they think they would come up with more because our emotional experience throughout our lives is so rich that we're actually surprised at how little emotions we can actually count when we think about it. So if we want to answer this question of how many emotions are there even using research, there are 2 studies that I find very interesting. One study from 2017 from UC Berkeley actually showed emotionally evocative video clips to 800 women and men, and then analyzed their answers and found that there are 27 different emotions. And there's also a very, like on their website, there is a very interesting interactive map that also shows how those emotions are connected, but they found 27 distinct emotions. Those emotions are, sorry. Yep, there we go. Admiration, adoration, aesthetic appreciation, amusement, anger, anxiety, awe, awkwardness, boredom, calmness, confusion, craving, disgust, empathetic pain, entrancement, excitement, fear, horror, interest, joy, nostalgia, relief, romance, sadness, satisfaction, sexual desire, and surprise. If you thought of any emotion that's not part of this list, then good job. And that's one way we can look at it. Another way, a little bit more prized way to look at emotions, is based on the work of Paul Ekman, a very, very famous psychologist that anyone who ever studied psychology will have heard of. And so his approach was not to just think about how many emotions there are or might be. He thought about how many emotions are expressed and recognized exactly the same way all over the world. How many emotions are basically part of our biological hardware. And he researched that question by traveling all over the world, even to very, very remote places. For example, when he visited the Four people, a tribe in New Guinea that had never been exposed to any media or Western culture. The picture you see on the slide is actually by a man in New Guinea who is mimicking 3 of the 6 universal emotions that Ekman then found. He later on added the 7th. And those universal emotions include fear, sadness, happiness, anger, surprise, and disgust. And then he added contempt later. And you see, sometimes it's really, also about how you look at it. For example, if we go back to the other study, you see here, they have fear and anxiety as different emotions. You could also think there are maybe 2, shades on the same spectrum. But yeah, so those are 2 ways to look at how many different emotions we actually have. Very important question as well is, why do we have emotions? And so here you see again the 6 basic emotions by Ekman, just with Western people mimicking them. One reason why we have emotions, or maybe the most important reason, is survival. I mean, if you can find emotions that are expressed and recognized the same way all over the world, then it means that they are part of us evolutionarily. And every part that developed through evolution is something that we need to survive. And if you think about it, actually makes a lot of sense. If we didn't experience fear, we would have no signal in us that tells us to seek safety. So we would expose ourselves to more danger, and our chances of surviving would be lower. If we didn't feel anger, we would not set boundaries or defend ourselves. If we didn't feel happiness, we would not go out into the world, and we would have no motivation. So we need all of those emotions basically to do what we need to do in order to survive. All of those thoughts also make even more sense if you think about if you think back a couple of thousand years or a few thousand years to when we were cavemen, because our emotional experience, a lot of our biology and DNA didn't change much, in a few thousand years. Our world is really changing quickly, but our hardware as humans isn't. So yeah, so one reason why we have emotions is basic survival. Another one is social interaction and communication. So there are specific emotions that I call social emotions that usually come up when we're interacting with other people or when we think about interacting with other people. And those would include embarrassment, shame, guilt, pride, contempt, emotions like that. Obviously, you could again then say, well, they're important for survival because humans don't survive alone. Back in the days, the caveman days, we couldn't survive alone. We needed to be in groups, but also today is really hard to survive alone. And yeah, so those emotions facilitate the connection between individuals. Emotions like love, empathy, and compassion contribute to cooperation and mutual support. Emotions such as embarrassment establish social rules that we have to adhere to be part of the group. And lastly, what we need our emotions for is to be connected to our needs. Every emotion comes up and points towards a need that needs to be met or that is being met. And that means that our emotions basically connect us to ourselves and to what's important to us. So someone who is not in touch with his emotions or her emotions is not in touch with themselves. All right, so we know there are 6 to 27 distinct emotions, and we know we need them to survive, to be part of a group, and to be connected to ourselves. But what is an emotional experience? I mean, we all conceptually know what it is, but can we explain it? What does it mean to feel an emotion? And so if you kind of look at it in more detail, you could say that an emotional experience includes specific thoughts, specific bodily sensations, and every emotion has some kind of message of what we're supposed to do. So some kind of action tendency. Let's look at all of those 3 components for a little bit. The connection between thoughts and emotions is maybe the most obvious, maybe. Also something we talked about in detail in one of the past webinars when we talked about thinking errors or cognitive distortions. And yeah, so it makes a lot of sense. If something happens to you, the way you interpret it will also influence the way you feel about it. If you fail at a test and then think, wow, I'm such a loser, you will feel bad. You will feel emotions such as shame, anger, sadness. And if you interpret the situation more in a way of like, okay, that sucks, I should have learned more, I will be better prepared next time, then you might also feel some kind of regret or sadness, but also compassion towards yourself and motivation to do better. So the way we interpret situations or think will influence the way we feel, but also the other way around. If I, after failing the test, think I'm a loser and feel bad, embarrassed, shameful, then I will also interpret other things that happen to me on the same day negatively, or in terms of self-criticism. Sometimes someone might say something neutral to me, but I might perceive it, as critical, and then that might make me feel even worse. So yeah, our thoughts and our emotions are connected to an extent that sometimes I feel like my clients in my private practice, sometimes they even have problems differentiating between the 2 of them. That's gonna be part of an example that we're gonna get to a little further into the presentation. And while the connection between thoughts and emotions is quite clear to a lot of people, what a lot of people forget is that emotions are deeply rooted in our body. You can already see that by the way we talk about emotions. Sayings, is that the right word? Sayings? Formulations? Anyways, things like my heart is racing, butterflies in my stomach, or I have a gut feeling are part, of the English language and also of other languages. And they already show that, emotions have some kind of expression or maybe cause even in our bodies. But that's something that is oftentimes overlooked because we tend to not be very connected to our bodies, but it's very important also when you want to regulate your emotions. It's very important for things like trauma. And so I want to encourage you to be more aware of how emotions are felt in your body. There's actually a really, really interesting study about that from 2014, where researchers presented emotion-evoking words, stories, movies, or facial expressions to 700 plus participants who were then shown big silhouettes of bodies, and their task was to tell the researchers where in their body they felt the emotion, and also whether they felt that it was an activating or deactivating feeling. Activating here you can see in yellow and red tones, and deactivating would be in blue. And the interesting thing that they found was that there were patterns that were similar between people. So the way we feel emotions in our bodies is not different for everyone. There are certain similarities and patterns. And I find that very interesting. And also it makes a lot of sense to me because, again, it shows how our emotions are also connected to our needs and even go as deep as being important for our survival. You, for example, look at fear in the first row and anxiety in the second row, which are similar emotions, you see an activation in the chest area. Now, if you think about why is fear important for us, as I said, it's important because when we're afraid, we will seek safety. What do we need to do to seek safety? We run. So our fight flight response is triggered when we're scared. And if we want to run away, what do we need? We need our heart to pump a lot of blood into the body, and we need our lungs to breathe in air more frequently. And that all happens in the chest area. So people feel an activation in that area when they are scared. So yeah, it makes a lot of sense. And lastly, emotions or the emotional experience include a tendency to act. And I kind of try to visualize that here, and I intentionally made the arrow that goes from emotion to urge or tendency to act bolder than the second arrow, because that's the point where we have a lot of control. We do not have control over our emotions. Our emotions will just come up, and we kind of can't control that. Our emotions will tell us to do something. Like if I'm angry, my emotion might tell me to punch someone in the face, and there's nothing I can do about the fact that that's kind of what I want to do inside. And as a therapist, I would never criticize anyone for that. But we do want to work on the actual behavior that follows. And then obviously we don't want to punch someone in the face. We want to do something else with the emotion. So yeah, every emotion tells us to do something, but we decide what we want to do in the end. Okay, I think that's enough theory about emotions. Let's think specifically or look at the connection between emotions and hair pulling. So for everyone who has suffered from hair pulling or is suffering from it, they will say, well, of course they are connected. Like, you don't have to explain that to me. And you could even look at hair pulling as some sort of emotional regulation skill that works in the short run, but causes damage in the long run. But let's just, so we're all on the same page, look at it in terms of the pulling cycle for a few minutes, and then we're going to move on. So the pulling cycle, for those of you who don't know it, means that every pulling behavior is part of a broader cycle with things that happen before and after it. So there are various triggers for hair pulling that then create some kind of urge, like this feeling like I want to do it. Then comes the actual hair pulling behavior, and that has short-term consequences as well as long-term consequences. And I want you to just take a few seconds and think about, okay, wait, where in those 5 steps do emotions play an important role? All right. So in my opinion, emotions play a very important role for the trigger. because a lot of times emotions can be a trigger for hair pulling. Anxiety, stress, sadness, anger, a lot of them. But also after hair pulling, you feel like this instant relief, and that can also come with certain emotions. And then in the long run, you might experience emotions such as shame, frustration, or guilt that can maintain the cycle, but also serve as kind of the next trigger that you then regulate using the hair pulling. So emotions play a really important role for hair pulling. And that's why tracking your emotions is key if you want to manage the hair pulling. Tracking your emotions basically means to create a lot of awareness for emotions, and specifically the ones that will trigger urges or the hair pulling itself. And when I talk about awareness, I feel like I talk about I feel like it comes up in almost every webinar that I give, and it comes up a lot in therapy. And so specifically when I was making this webinar, I was like thinking, Sophia, are you out of ideas? Why do you always talk about awareness? And I think the reason is that it is so hard to create awareness for our thoughts, for our emotions, for our bodies. It is very, very, very hard, and it is a significant part of almost every therapy. And I talk about it because it's so important to encourage people all the time to create awareness for their behaviors, thoughts, and emotions. And it is so hard because because we don't want to feel our emotions, because it's difficult, because it's not a pleasant experience when it's negative emotions, and also because our society and or the way we live with all the technology makes it so easy to not be aware and to be distracted all the time and distract ourselves. I mean, I only have to take up my phone and there we go. Distraction. I literally just took my phone, and then the picture on my phone came up, and I'm distracted. My thoughts are somewhere else. That's how easy it is. So it is a conscious effort, and I want to just give you some advice on how you can do it. So to track your emotions, different things you can do include to tune into your body. Tune into your body if you experience any kind of emotion, and if you have a hard time even noticing when an emotion comes up, then just set yourself reminders to 3, 4, 5 times a day. Just tune into your body for a few seconds and just feel what's there. And as soon as you are connected to the physical sensation of an emotion, you are deeply connected to the emotion. That's how it works. And once you are connected to the emotion, you can deepen your experience by giving the emotion a name. Sounds very easy, not always that easy to do. And once you have a name for the emotion, try to be specific. For example, you feel like you're anxious, then think about it. Is it fear? Is it panic? Is it agitation? Is it worry? What is it? Can I be as specific as possible? Is it more than one emotion? The third step would be to define the intensity. I recommend on a scale from 0 to 10 or 1 to 10. So if you feel angry, think about it. Am I angry on a 3? Am I close to exploding? Is it 8, 9, 10? Because that also will give you an indicator of how difficult it's going to be to deal with this emotion. And then lastly, reflect on the emotion. Think about it. Where is this emotion coming from? What does it want me to do? What does it want from me? Why am I feeling the way that I'm feeling? And once you do that, this in itself can already lead to some kind of relief and regulate the emotion in some sense, because the moment I understand why I feel the way I feel, I'm already more compassionate towards myself. And so those 4 steps, tuning into the body, naming the emotion, thinking about the intensity, and reflecting, sound very easy. They're not as easy as you think. So I want to just give you an example of how this can look like, specifically from in the case of therapy with a psychologist, but that doesn't mean that you cannot do it on your own. So let's say a patient comes in and says, and then I told her about that presentation that I had to prepare for next week. Listen, she didn't even react with one word. I walked away and didn't talk to her for the rest of the day. Now I feel so bad. I completely overreacted. Therapist, let's see if your response was really disproportionate. How did her not reacting make you feel? Patient, it made me feel like she doesn't care about me. Therapist, it made you think that she doesn't care. But how did you feel inside? Patient, I felt like my chest wanted to expand and my head felt warm. Okay, so we have an incident where the patient noticed he was feeling something, and then the therapist and the patient tried to look deeper into it, but in the beginning, the patient kind of confuses their thoughts and emotions, and only eventually does he tune into himself. And his way of doing it is specifically by noticing how the emotion makes him feel in his body. Therapist, okay, so you felt it in your chest and head? Yes. Therapist, do you have a word for the emotion you felt? Patient, maybe I was annoyed? Therapist, I think we're heading in the right direction. Patient, maybe even a little bit more. I was furious. Why was I so mad? Maybe she just didn't pay attention. She didn't mean to make me mad. Okay, so here we're already talking about naming the emotion, understanding the intensity of the emotion, and the patient starts reflecting, where was this coming from? Why did I feel the way I felt? Therapist, dig a little deeper. Was anger the only emotion present? Patient, I don't know what you mean. Therapist, you said earlier that you thought she didn't care about you. What emotion could that thought evoke? Patient, disappointment, pain. You know what? Now that I think about it, I also felt ashamed. I am extremely stressed before presentations, and it's hard for me to open up about it. Therapist, listen, now that I understand the situation better, I can completely understand why you felt and acted the way you did. Okay, so now we see even further reflection. There was not only anger, there were also other emotions, and that we understood that based on the thoughts that came up. And in the end, I think it's a really good example of how when we understand our emotional experience, and even if other people understand it, in this case, the therapist, then we will be more compassionate. And I'm sure that this patient at the end of this conversation already felt a little bit better. Yeah, so you see, it's not as easy, and sometimes we need a little bit help when we want to really dig into our emotional experience. Another way to do it, you can do it alone, you can do it in therapy. Another way to do it would be the self-monitoring tool that we offer at TrichStop in the online program that I work for. So the self-monitoring tool has the advantage that you track your emotions specifically in connection to the hair pulling. So once the urge comes up, or once you notice I'm pulling or I just pulled, through this app, or not app, tool, you can identify when it happened, where and why. You can distinguish between actual pulling or just the urge, the body areas affected. And then you can identify the emotion and also the thoughts that came up or even triggered the urge or the pulling, the intensity of the experience. And in the end, the tool will give you some kind of analysis of of what happened. Specifically, this analysis will be even more helpful the more you log, the more you monitor yourself. And then if you subscribe to our service, you would even have, the guidance of a therapist who can look at all the entries in the tool and help you analyze the situation together. All right. So what now? Right? I showed you some ways or advice on how you can track your emotions, but let's say you're now the emotion tracking master and you're so completely aware of every emotion that comes up throughout your day. What can you do with those emotions? And generally, what we want to do is we want to regulate the emotion, but I find the term already a little bit misleading, because when we talk about emotion regulation, maybe you have some kind of idea of like, if you regulate my negative emotion, it will go away. But that's not the right approach to emotion regulation. Our emotions are part of our lives and they connect us to ourselves and to our needs. They're our compass. So the goal is not to make every emotion that comes up go away. It's actually quite unhelpful to do that. So some things that are not emotion regulation. Let's take the example that I presented to you in the beginning. Not in the beginning, but previously. So the patient says, and then I told her about that presentation that I had to prepare for next week. Listen, she didn't even react with one word. I walked away and didn't talk to her for the rest of the day. Now I feel so bad, I completely overreacted. So one way to deal with emotions that happen in this specific example is letting the emotion take over. That's obviously not emotion regulation. It's just doing blindly and oftentimes unaware, without awareness, what the emotion tells you to do. And in this case, our patient felt anger, pain, and shame. The anger tells him to fight, in this case, to punish his wife for not listening. The shame tells him to hide. And he wasn't even aware that he was ashamed, but the emotion was there. Our emotions are there, even if we're not aware of them. And that pain tells him to lick his wounds, to take care of himself. Emotional pain oftentimes has the same effect as physical pain. And so he kind of engaged in this passive aggressive behavior that ended up with him not getting any comfort from his partner, and being alone, and also in the end kind of like questioning his whole emotional reaction, thinking, okay, what was just going on with me? That's because he lets his emotions take over without even noticing. Another thing we don't want to do is suppress or run away from our emotions. In our case, if the client would have said, this was too much, I had to just turn off my head a little, so I binge played video games for the rest of the night, that would have been one way to just kind of suppress the emotions. Other ways would be hair pulling, or drinking alcohol, engaging in excessive sports, overcompensating through food. All of those things are ways to suppress or not feel the emotion right now that cause problems later on. And lastly, we don't want to deal with our emotions by invalidating them. Our patient specifically invalidated his emotional experience a little bit afterwards when he said, now I feel so bad, I overreacted. In therapy, I try to never make patients or anyone feel like they're overreacting, because every emotion has a reason why it's there, and also the intensity. And if you really understand yourself and where you're coming from, you will never feel like you're overreacting. Your emotions are always justified. But a lot of people, specifically also people who tend to engage in people pleasing, invalidate their emotions in order to avoid, for example, setting boundaries. Someone does something hurtful, and I would rather just say, like, I understand why they did it, and then kind of invalidate the fact that I'm hurt then to actually confront them and set boundaries. And then we will say things like, why should I be hurt? She probably has her reasons. She has so much on her plate. Why am I such a whiny person? So what if she didn't pay attention? And that might be easier right now because I don't have to actually do something with my emotions, but I'm invalidating my own emotions. I'm invalidating my needs, and I'm not connected to myself. So it's not a good strategy in the long run. All right, so what we don't want to do is let the emotion take over, suppress or run away from the emotion, or invalidate the emotion. You might feel like, okay, so back at square one. What now? What do you want me? Like, you want me to be aware of all my emotions? What am I supposed to do with them? So what you're supposed to do with them is something different. And before I actually will explain that to you in theory, I would much rather invite you to try it out with me. To do that, you have to do nothing except for listen to my voice and do what I'm telling you to do, in the comfort of your home. And so just bear with me, just go with it. You're going to take more out of this webinar if you actually do the exercise with me. All right, let's take some deep breaths in through our nose and out through our mouth. In through the nose and out through the mouth. And then I want you to just connect to an emotional experience, negative emotional experience that you had today or in the past week, in the past days. And kind of let this emotion come up again and connect to it. And once you connect to this emotion again, let's try out the strategy. First of all, gently turn towards what you're experiencing in an open and non-judgmental way. Tune into it. Tune into your body. What thoughts and sensations come up? Maybe even give it a name. I'm feeling angry, stressed, sad. And once you're there, allow yourself to feel exactly as you're feeling. This is what's happening. I'm not going to change it, act on it, or try to push it away. Yes, this is what I feel, and it's okay, because feeling bad or experiencing pain is part of life. As a next step, I want you to be curious, investigate. What does this feeling want from me? What am I believing about myself or others? Where is this emotion coming from? And as a last step, I want you to ask yourself, what do I need right now? Which isn't always that easy. Think to yourself, right now, what I need the most is. Maybe there's something you need to hear, something that a loving person would tell you right now. Might be something like, I care about you, I'm here for you. If you've screwed up in some kind of way, perhaps remind yourself that you are human, that everyone makes mistakes, that no one is perfect. you're critical towards yourself, maybe you want to tell yourself to give yourself a break, or maybe something else. And if you can't find the words, maybe putting a hand on your chest or your abdomen will comfort you in a different way. Let's take 1 or 2 more deep breaths in this state. And slowly come back to the present moment and to this presentation. So that was the RAIN technique. RAIN stands for recognize what is happening, allow life to be just as it is, investigate your inner experience, and nurture. And I added repeat because that's something you have to practice regularly so in order for it to really help you. You might think now, well, I don't have time to do, a 5-minute meditation every time a negative emotion comes up. That's completely true. Even if you manage to practice 2 or 3 times a week, that's already a big change and a good start. And the more you practice, the quicker it will be. Very soon, you're not going to need guidance because you're just going to internalize those 4 steps. And then at the end, it can be a very, very quick thing. I mean, eventually, the idea is that this is going to be your automatic reaction to negative emotions and a way to comfort yourself. So yeah, I want to really encourage you to practice this. It's a very not popular, but like a lot of people know this technique. A lot of therapists recommend it. You can find information about it or guided meditations online a lot, on YouTube, on the internet in general. Yeah, and so recognize stands for tuning into the present moment, understanding which thoughts, sensations, or urges come up, and maybe finding some words for your experience, just like I'm feeling stressed, I'm feeling overwhelmed. The allowing is very important. That's the opposite of, suppressing the emotion, running away from it, and validating it. So you don't need to like it. Negative emotional experiences can be very difficult to stick with. You don't have to like it, but try to soften your mental resistance to what's happening and accept that having negative emotions is an important part of life, unfortunately. Then investigate, try to understand yourself better, try to think about what's going on, which thoughts am I having, what is this emotion making me feel bad about myself or others. Just dig a little bit deeper. And then the nurture part, that's very important. You could also call it self-compassion. Try to understand what you need to hear now and what you need. Try to replace self-critical, negative self-talk with caring self-talk. And oftentimes, we develop a few mantras that are specifically helpful for ourselves that we kind of tell ourselves again and again, just like, don't be so hard on yourself, or a different one. But you have to understand what makes you feel good. You'll notice when it's the right thing to say, or the right place for your hand, or the right thing to do, because it's going to make you feel better. All right, I'm already a little bit over time, so let's just conclude. We have 6 to 27 distinguishable emotions that we can feel. We need all of them to survive, to thrive in groups, and to stay connected to ourselves and our needs. To feel an emotion means to be present, understand what's happening in your body, not understand, feel what's happening in your body, be aware of your thoughts, and what the emotion tells you to do, of the behavioral impulses. Emotions play a crucial role in triggering episodes of hair pulling in its short-term gratification and maintaining it long-term. So that's why being aware of emotions and tracking them is key in order to learn to cope with hair pulling. You can do journaling, you can do it in therapy, you can do use a self-monitoring tool. And regulating emotions means to recognize the emotion, accept it, and console it, and not to run away from it, let it take over, or invalidate it. Here, just a short reminder of our free resources here at TrichStop. We have the monthly webinar, which you are obviously aware of because you're attending one. We have our website. On the website, you find online forums and blog entries that we update all the time. And we're present on Facebook, Instagram, as well as TikTok. And yeah, if you want to join, if you want to subscribe, there is a discount code right on this slide that will give you a $100 discount on the first month. And now, without further ado, let's jump into the Q&A session. We have about 15 minutes left for that. I see there are already 2 questions. I'm gonna go there. If you raise your hand, I'm like, please ask the question in the Q&A section, and don't raise your hand because I don't know what to do with that. Oh, wow. Yeah, good question. Hi, I have to drop for a work meeting, but will this webinar be available for future reference? I guess this person's not with us anymore, but yeah, there's a recording of every webinar we do, and it's going to be on our YouTube channel, TrichStop. Answer that question. That was easy. Okay, there's a question. I'm gonna read it to you. You say you should identify the emotion you are feeling. What if you suffer from severe anxiety disorder and bipolar depression? In fact, the hair pulling did not start until I was given risperidone. Presently, I am 1 year free from hair pulling through hard work and using the supplement NAC. I use stress squeeze balls constantly. Okay, so first of all, that really means that you have a lot on your plate. And well, congratulations on being free from hair pulling for 1 year. That's an amazing achievement, in my opinion. If you suffer from severe anxiety and bipolar depression, that means that you are going through a lot of very intense emotions frequently. So that's very, very difficult. I think it's still important. I mean, I don't understand completely the question. Maybe what you're trying to tell me is that, well, I have so many intense emotions, I cannot be aware of them all the time, and I have an overload of emotion that actually has a clinical title, like severe anxiety and bipolar depression. And that still means you can stay connected to your emotional experience. I mean, you know, when you suffer from depression or anxiety, it's really difficult to be with this emotional experience all the time. But like, some of the main problems are that it are not the emotion you're experiencing, but the way your emotion makes you behave. So as long as you are aware, for example, of like, I'm anxious, you know, I'm anxious, my anxiety tells me to not join the date that I scheduled with my friends tonight. So you can be aware of the anxiety and you can comfort yourself in in this anxious state by using, for example, the RAIN technique, but it doesn't mean that you have to do what your anxiety is telling you to do, like stay at home. You can make a conscious decision and say, okay, I feel anxiety and that's very difficult, but I'm still going to do what's important to me and what's best for me in the long run. I mean, also depression, what depression tells you to do is, stay at home. It gives you, makes you think a lot of negative thoughts that make you feel bad about yourself and the world and your future. But as long as you stay aware of the emotion and try to comfort yourself in the emotion and then make a conscious decision to act, in a way that's gonna make you feel better and that's gonna be good for you in the long run, and that's gonna make you live your life in a way that's important to you, then yeah, you don't have to, make your emotions stop you from what's important to you, but it also doesn't mean that you should avoid feeling those emotions, as difficult as it sounds. How do you help an elderly person who has dementia and pulls their hair to track their emotions? Ooh, that's a difficult one. I mean, it really depends if the dementia has progressed as far as that the person couldn't, um, kind of track their emotions on them by themselves, then it would mean that you would have to do that work for them. The steps that I showed to you before, for example, if you know, I mean, because dementia can come with a lot of, emotional outbursts and intense emotions. And if you notice that, you could, try to guide that person through the steps of tracking your emotions externally. Like you could be their therapist by, telling you, I notice, you are having an emotional experience, or you seem very angry to me. What's going on? Are you aware of that? How does it feel in your body? What are you thinking right now? Where do you think this emotion come from? But yeah, that will also, require a lot from you as a person who's close to them. And yeah, I don't want to give any advice that will lead you to a point where you will neglect your own boundaries and limits. So that's definitely a very difficult one. You could be there for them and help them with it. But I would definitely advise you to also try to help that person find some competing response, some kind of other thing that they can do instead of the hair pulling. That might be a little bit more practical. Um, yeah. In cases where the negative emotions are severe and everything doesn't seem to work, what should I resort to? That's also a very good question. In that case, there's two ideas that come up. One would be a grounding technique. You can look that up online, grounding. I also did a grounding exercise in my past webinar. Which one was it? Dealing with compulsions. It's very, very easy. It's not easy to do. It's a simple technique when you're really emotionally, if you experience a very negative, intense emotion, it's not easy, but it's a simple thing. So you kind of try to connect to the present moment again through your senses. Um, for example, telling yourself 4 things you see, 3 things you hear, 2 things you feel, and 1 thing you smell. And that sounds very simple, but just if you close your eyes, or like don't close your eyes for the things you see, but if you stop for a second and connect to your senses, everything will become a little bit more quiet around you, and then you can do other things to calm you down, for example, a self-compassion exercise just as the nurture part in the RAIN technique, or reflect on your emotion, or do some emotion regulation techniques that are specific for high stress situations, like taking a cold shower, or biting on something hot, like something with like a hot flavor, not hot temperature wise, because you don't want to burn your tongue. Just to tone it down a little bit, the intensity of the emotion, and then once you are more in control, you could still do something like the RAIN exercise that I showed you before. So if you want to research that further, the first one would be a grounding technique, and the second one would be stress tolerance skills. If you look that up online, you will find some examples. We use mats for this, or fidgeting stress balls, bracelets, and more. Also tried gloves and hats and caps, etc. For the elderly dementia person. Other options. I would advise you to check out one of our past webinars. We had a complete webinar by one of our expert therapists, Laura Santner, on fidgets, and she gave a lot of different examples, and she even made a very comprehensive list that you can find online. So if you want to have more ideas on that, I really recommend you to go online to our YouTube channel, TrichStop, and watch her webinar. I have to sneeze. Sorry. Okay. My daughter appears to have started pulling out her hair because of anger. She says she didn't want to take the anger out on us, so she took it out on herself. Now she appears to be addicted to it and pull her hair even when she's not angry. She does it even when she's bored. That's very common. I'm not even sure she's aware of pulling her hair. She seemed to reduce it for a while and then suddenly pulled a huge amount off. We have adapted as much as we can and trying not to increase her stress and be judgmental and to be supportive. That's great. She gets stressed out by exams in school, and I think that triggered her last hair pulling episode. I tell her that her happiness is more important than her grades and try and get her to stress out and try and get her to, I guess, stress out less. But I can only do so much. Wow, that's a difficult situation as well. And I'm guessing you're asking me for advice. So first of all, I would say I would want to establish rules in your family, because the original trigger was her feeling like she cannot take her anger out on you. And I mean, like, obviously you don't want her to take anger out on you, but maybe, go through some kind of communication strategies on how to expressing anger, because she doesn't want to, if she's not expressing anger towards you, she might also have difficult expressing anger towards, friends and other people. And expressing your anger is very important. So first of all, I would work with her on how to be able to express and talk about boundaries, and giving anger some expression that is not yelling at people or doing something aggressive. But it also seems like she's stressed by other situations as well. I really love what you said, that her happiness is more important than her grades. So, just my dog's walking in the background. Yeah, try to support her and show her that her mental wellness and health is important to you. Be supportive. And then, I mean, this is a classic example of how hair pulling can start and then turn into an actual clinical disorder. So I would say she needs therapy. Best case scenario, habit reversal training, which is what we offer at TrichStop. If she's age 14, 15, then she could sign up for our program, but you could also look for a therapist around you that will help her deal with her symptoms. But this sounds like something that is too much for you as a parent to handle alone. But it sounds like you're already aware and trying to be as supportive as possible, which is great. But as a parent, you cannot therapize hair pulling. You need a professional. Okay, we're running out of time. I'm going to try to answer some more questions. In reference to the cycle you discussed of trigger, urge, pulling, short-term consequence, long-term consequence, how do you prevent the shame, frustration, and guilt from starting the cycle over again? Well, first of all, when you feel the shame, frustration, and guilt, you could do the rain exercise to manage those emotions and alleviate them a little bit. What you could also do is a self-compassion exercise. Actually, in the this webinar that I did on how to manage your compulsions that you can find on our YouTube channel, I also did a short self-compassion exercise, I think live. And I gave kind of ideas of how you can deal with each one of those 5 aspects of the hair pulling cycle. So yeah, I mean, what you want to do when you feel like this shame, frustration, and guilt is to be compassionate with yourself, remind yourself that managing to cope with hair pulling is a process and that you cannot stop from one day to the other, and be good and caring towards yourself. Okay, that's a very common question, a good question. I would like to add to my previous question that I learned about the supplement NAC through the trichstop.com newsletter. NAC has been absolutely fundamental in stopping my hair pulling. So it's not really a question, it's kind of sharing an experience, and that I'm so happy to hear there's actually a really new article that just came out recently, a systemic review. Systemic review means that the researchers didn't do their own research. They basically looked at all the existing research in a certain field. And what they did, they looked at all the existing research of the effectiveness of medication for BFRBs in general, which means body-focused repetitive behaviors such as hair pulling, skin picking, etc. No, this one was specifically for hair pulling also. I'm sorry, I'm going to start over. So what they did the systematic review on medication in hair pulling, and they found that research concerning NAC so far is very promising, and that most of the studies they analyzed showed that it had positive effects, and specifically that it's most effective if you combine it with psychotherapy, such as CBT, habit reversal training, or acceptance and commitment therapy. And I'm so happy that also for you, it had a positive effect. Okay, my 11, there's 2 more questions that I'm going to try to answer, and then I'm going to run out of time. My 11-year-old daughter just admitted to hair pulling. She pretty much has no eyebrows left. She is an A student and great athlete. We had no idea she was under this kind of stress. What would you suggest? Okay, she just admitted to hair pulling, but that doesn't mean that she just started doing it. I would definitely suggest therapy. in some shape or form. Habit reversal training, that's what you're looking for. That's the gold standard treatment for hair pulling. We also have webinars on that. If you want to learn more about that, watch the webinars, and you can already help her, or even watch the webinar together with her if she's, a smart kid. If you already want to start working on it, but I mean, professional guidance would be better. And also I would talk to her about, the pressure that she feels and why it's so important for her to be, a great A student and a great athlete. What does she, what makes it so important for her to succeed? And if she's very, children and also us adults, when we're high achievers, when it's so important to us to succeed and to well, I'm sorry, I'm running out of words. When we're pushing ourselves so far, that means that we're really afraid of failure, and that we have some kind of idea what happens if we fail, if she gets a bad grade, if she's not a good athlete. What does that mean? And it usually means that we define our self-worth through our success. So what I usually do in my private practice, also with children like that, is that I try to build some kind of identity or concept of ourselves that's not related to performance. What makes me a special person that's not related to how well I perform in school or in sports, or how good of a daughter I am. What makes me special, that I don't have to do anything, that I don't have to achieve to have. If that makes any sense. Yeah, so therapy and establishing a sense of identity that's not related to their achievements. Okay, last question. I'm so sorry, I'm not going to get to the other questions that were posed because I'm already over time. No anger felt in the person with dementia. 2 questions for me to ask the person, as I'm not there all the time. Always says I'm fine, I'm okay, yet hair pulling goes on. So yeah, it really sounds like they might have resistance to sharing, or are unaware of their emotions, have a hard time connecting to what's actually triggering the hair pulling. And then I would continue to work on the level of symptoms. As you said, you're already doing a lot of things. You're trying to help them establish a competing response. You could also think about stimulus control. If you find out about things that trigger the hair pulling, then deal with those triggers. Although I think you mentioned some stimulus control strategies as well. And maybe also try medication, just as I said, the recent review that came out. I'm not, by the way, disclaimer, I'm not a psychiatrist, so I cannot really recommend specific medication or dosages or whatever, but research shows that NAC and also SSRIs can be effective. So that would be maybe an additional thing to try out if you're not doing that yet. All right, so I'm out of time. If there are any questions left that have been asked now, or that come up later, you can definitely write for customer support, customer service, support@trichstop.com. If it's clinical questions, they will also consult with me. And yeah, thank you for participating in this webinar. Thank you for all the questions, and I hope you have a nice rest of your day or evening, depending where you are in the world. And I hope you're going to join in the next webinars to come.